Good morning, everyone, and welcome to another Medical Minute with Colorado Springs Orthopaedic Group. And today we are sitting down with Dr. Huang talking about skiing and snowboarding injuries, which is so important. Again, in Colorado, everybody loves to ski and snowboard out here, but it's so easy to get injured when you're out there on the mountains.
It can be, that's right.
Yeah, so let's kick things off and talk about knee injuries. What are the most common ones that you see?
So they're really based on soft tissue injuries typically. You can get some fractures, but the injuries we see mostly are meniscus tears and ligament tears. And in the ligament tear category, the most common or most well-known, probably anterior cruciate ligament injuries, ACL, and medial collateral ligament injuries, MCL.
What occurs when, the ACL or the MCL are torn while you're strapped to skis or snowboards?
Yeah, it's a pretty unique situation because, as you can imagine, with long boards on your feet and a fixed boot, a lot of the stress goes through the knee. In skiing, it's been well studied, and usually what happens is the athlete gets in what's called the backseat position, and their bottom gets over the tails of their skis, their knees flex, then they kind of rocks in. That produces this rotational force across the knee that has been demonstrated to tear the ACL and the MCL, and sometimes the meniscus.
So there are ways that we can, try to avoid these injuries as best as possible, and that is to strengthen your knees. So what are some exercises you think that might be good for people who are hoping not to get injured out on the mountain this year?
Yeah, I think over the years, in the past decades actually, there's been great attention towards trying to prevent these ligament injuries, and it's all about conditioning. And actually, usually beginning in September, October of each year, you'll see these advertised in the larger gyms as ski conditioning classes, which are very, very helpful. They tend to focus on several things: plyometrics, cardiovascular fitness, and a lot of core and hip strengthening. Actually, gluteal strengthening is super important. The knees are below the hips, and so the stronger the hips and the core are, the knees can be better prepared.
Okay, and I can speak from experience. I've done some of those before starting a ski season, and it really helps you. Once you get on the mountain, you can kind of feel all of that work that you've done, and you feel more confident almost.
Right.
That's so important.
Exactly right.
All right, well, what are some other strategies maybe people can think about as they're heading out into the mountain this ski season that they can do to prevent those injuries?
Well, a lot of it's equipment based as well, and then skier level as well. So on the equipment side of it, you hear this all the time from the ski professionals and ski shops, but it's super important. You want to make sure your equipment is up to date, your ski boots fit, they're tuned, the edges are good, and that you're familiar with the equipment. You're not borrowing somebody else's pair of skis or snowboard, right? You could be out of your element. The second thing is about skier level. And if you're new to the sport or it's been a while, don't just assume that you know how to do it. See a ski professional, get lessons. That's probably the most important thing you could do, the best money spent. Otherwise, you'll be spending your money on surgery.
Absolutely. Ski lessons, they have tons of great indoor ski lessons that can get you ready for the season so you can avoid getting injured out there.
Exactly right.
Perfect. Thank you so much for all those tips this morning. And again, for more information on Colorado Springs Orthopaedic Group, you can go online to csog.net.
All of that information is up on your screen right now, and this segment has been sponsored by Colorado Springs Orthopaedic Group.
All right, everyone, we'll be right back with more Loving Living Local coming up right after the break.